everybody, it's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your plastic surgery questions, and of course go over plastic surgery topics. And once again, I'm happy to go over anything related to plastic surgery, from head to toe, from pre-op to post-op to long-term care and everything else, okay? But today is October 1st. And so what does that mean? It is October, Pinktober, or Breast Cancer Awareness Month. So we do dedicate a lot of our talks, a lot of our educational content to breast during the month of October because we also want to bring that awareness to breast cancer and, importantly, from our point of view, breast cancer reconstruction. So this is something that I used to do a lot of when I was at the Cleveland Clinic. So I worked at Cleveland Clinic here in Florida and Weston for 5 years before opening pure plastic surgery here as my private practice. So I have quite a bit of experience with breast surgeries and breast reconstruction as well. So kind of on that note, talking about breasts, I wanted to kind of just lay out what are all the different types of breast surgeries that we provide here at Pure Plastic Surgery. Because a lot of times I'll get a question like this, like, hey, Dr. Earl, what is the price or the cost for a mommy makeover? And so I'm typically like, well, I can't give you that because it's really going to depend on what exactly we're doing with the breast. So a mommy makeover is a combination of a breast surgery with a tummy tuck, but the breast part of it can be variable. The tummy tuck's always typically a full tummy tuck, but the breast part can change, right? And so depending on what we're doing, that's going to alter the price, of course, because some things take a lot more time and are a lot more technical than other things, all right? So just to kind of globally give you guys a look as to what are the different options that we have to enhance the breast, okay? And so these are all broken down right here. So we have I listed 5 different options, okay? So the first one is your breast augmentation, and then you have a breast lift. After that, you have a breast lift with implants, so kind of combining these two. You have your breast reduction, and then last, but certainly not least, especially nowadays, is your fat transfer to the breast, okay? So I'm going to dive into these kind of briefly, just so you get a good overview regarding each of these, okay? But before I do that, one of the things that we're going to get asked is, well, hey, doc, which one do I need, right? And you know what? It's not for you to know because you haven't, let's see, what I do. You haven't studied for 17 years to do what I do, right? You didn't go through med school and general surgery and then plastic surgery residency and all that. So yeah, it's a great question and it's not for you to know. You need an expert to let you know. And so that's going to also depend, of course, on seeing your photos, your evaluation, and taking your measurements so that we can determine what is going to be the best procedure for you and also what's going to be, say, for example, the best implant for you, given, all of that, okay? So, breast augmentation. Breast augmentation is for people, for women that don't have any droopiness to their breasts, okay? So the way we measure the droopiness of the breast, technically called breastosis, there's, different degrees, okay? So we have first degree, that means no ptosis, second degree, and then third degree, so it all, becomes more and more droopy or more and more ptotic as you move along with the degrees, okay? So if you have no ptosis whatsoever, then you get a breast augmentation. This is typically my preferred approach. I like to place it what's called through the inframammary fold, which is like the fold right underneath the breast. I make a tiny, tiny incision there. There's no reason this incision needs to be large, right? I've seen incisions there from other surgeons and they're like almost all the way across. It's like, no, you don't have to do that. I make a tiny incision, maximum 3 centimeters, very small incision through there. And then I have special tools with lights where I can make the pocket through that tiny incision. And then I use a funnel to then be able to squeeze a bigger implant through a tiny incision. And that's what allows me to make that very, very small incision. I like to place it in what's called the subfascial pocket. So before there only used to be 2 pockets. It used to be below the muscle or above the muscle. And it was called subpectoral or subglandular. But now there's a newer technique which I've been doing for the past couple of years, which is called subfascial. And that's a third pocket. That's the one there's this thick layer above the muscle called the fascia. And I can actually sneak in beneath the fascia, but still over the muscle, create that subfascial pocket. It's the best of all worlds because you have super, super low capsular contracture rates, but you also don't have that animation deformity. So, sometimes when you place an implant below the muscle and the patient does certain movements or exercises, the implant kind of jumps and moves around because the muscle is moving the implant around. So when you do that subfascial approach, you don't have that. So this is a great approach for everybody, but especially for those athletic women out there, okay? And then of course you have your different options in terms of implants, and there's going to be a ton of options there, and I can do a whole talk just on implants themselves. But just to know what we offer here, we offer two basically major brands. We offer Natrel and Motiva. So those are two types of implants that we offer here. And then of course after that you're going to get into several details, right? Is it going to be a high profile, a moderate profile? What's going to be the size, the volume, etc. And that's all going to require basically an evaluation and measurements. Okay, that's the breast augmentation. Next you have your breast lift. This is when you have some droopiness to the breast. And this can be done, this can be after weight loss, it can be after pregnancy. And it's super popular nowadays to do a breast lift without an implant. So this is actually something that's trending up. More and more women are doing breast lifts and not including an implant. And that there are several reasons for that, but one of them is just like the trend nowadays is not to have super large breasts. It's going to kind of go for more of that enhanced natural look, okay? But within the breast lift, there's different types of lift, and that's also going to depend on how droopy the breast is. If you have a first degree ptosis, that's the least amount of droopiness, then you can do potentially what's called a donut lift, where the incision is just around the areola. So if you have a breast, right, and you have the incision just around the areola, that's called a donut lift. And then the next, second degree ptosis, you're going to have what's called a vertical or lollipop type lift. So that includes the one around the areola plus a vertical line up and down. And then if you have a large degree of droopiness or ptosis, then you're going to go for that anchor type pattern, which is probably the most popular pattern that we use. And so that's going to include all the way around the areola, vertically down, and then underneath the breast. Okay? So those are the different types of lift. And it's really not that much up to the patient, because I know a lot of patients are like, I just want a donut lift. Well, if you have grade 3 ptosis and the lympho positions at the lowest part of the breast and below your fold, you're not going to be able to get a donut lift. Okay, it's not like Burger King, have it your way, right? It's about what you actually need. And so you have a grade 3 ptosis, you're going to need an anchor lift. That's it, bottom line. Okay? All right. Then, of course, you can combine the two. You can have your breast lift with implant, so we can do both things. Typically, when we do this, of course, the breast lift is able to remove all the excess skin of the breast, and then the implant, that's typically what's going to provide you that nice upper pole fullness. So that's why we want to combine it, especially if you have massive weight loss. Sometimes when you have massive weight loss, you lose a ton of breast tissue, and you especially lose it in that upper pole. So it's like super empty up here. So we need to give some volume back to that area, right? You don't want to have an empty breast syndrome. And so we have to give back the volume, and so we do that with an implant, especially give you that nice fullness in that upper pole. Okay? Now, what if your breasts are super large, right? You have very large breasts, they're causing you back pain, neck strain, all these issues, shoulder grooving from the bra and all this stuff. Then we can do a breast reduction. And typically the most common type of scar pattern for a breast reduction is going to be that anchor type pattern that I discussed right here, okay? Women are super happy with breast reductions. These are one of the most, in terms of patient satisfaction, it's one of the highest patient satisfaction in breast reduction, because not only does it look better, but they feel so much better, because imagine you're just not carrying all that weight around all the time. And so you have a lot less back pain, a lot less neck strain, and this is like on the daily, and you feel freer, you're like able to do some of the things you couldn't do before, you feel more athletic, you can get back to the gym, you can do sports and stuff like that. So it's really a lot of high patient satisfaction with a breast reduction surgery, okay? And then last but not least, we're talking about fat transfer to the breast. So this is something that's kind of gained a little bit in popularity nowadays as well in 2025, as people are shying away a little bit from the implants, so they're doing more breast lifts without implants. They're doing a bit more fat transfer to the breast. Typically, fat transfer to the breast, again, it's going to be for the similar patient as a breast aug, somebody that does not have any droopiness or ptosis. Although sometimes you can combine a little bit of fat transfer with the breast lift, but usually you stage it. You can do your breast lift first and then come back and do some fat transfer. Usually not all at the same time, okay? But if you have no ptosis, you can do some fat transfer to the breast. but there are some key differences here that you have to understand. Typically, you're very limited as to how much fat you can transfer to the breast. So it's going to be like a modest change. It's not going to be a big or a dramatic change. The most you can typically put in is about 200, 250 cc's max of fat to the breast, which is equal to like a small implant. So it's going to be a very modest change. You can't think of it for like a big or drastic change. And the other thing is that yes, it can increase your volume modestly, but it won't change the shape of the breast. So if you have a breast that's like very like tubular, like tuberous breast deformity, or if you have a breast that's very cone-like, or if you have a breast that's not giving you enough fullness, kind of in that medial section, in the cleavage section, or things like that, it doesn't do a great job in changing the shape of the breast. Okay, so you basically need to like the shape of your breast, you just want a little bit more volume, and that's where the fat transfer to the breast comes in. But if you don't like the shape of the breast, or if you want a significant change in volume, then we're going back to the implant in order to achieve that. Okay? All right, so that was a quick overview of all the options there are for breast surgery, and I'm happy to answer any questions regarding this or any plastic surgery topic.
All right.
All right.
When can you start weight training post BBL?
Okay, great question. So after a BBL, and actually most of our surgeries that we do here under general anesthesia, you're gonna have to wait at least 6 weeks. Okay, so 6 weeks before you head back to the gym to do weight training or more heavy lifting or strenuous exercise.
Okay. And do you do vaser liposuction?
Yeah, we certainly do. In fact, I love the vaser so much that it's actually part of all of my liposculpture cases. So anytime I do a lipo 360 or a BBL, the vaser is going to be included and part of that because it helps me remove more fat with less bleeding, less inflammation, and better skin retraction.
When can you sit without a pillow post BBL?
So in order to sit without the BBL pillow, you have to wait 6 weeks. Okay?
Can I get a skinny BBL if I am 18 to 20% BMI and I am 125 pounds?
So I would like you to be closer to the BMI of 20, not the 18. But yes, if your BMI is about 20, that's kind of the lower end, but you would then be, of course, considered a skinny BBL, and we could typically do the BBL at that time. So BMI 20, 21 would be perfect.
Do you work on calves or ankles?
So I do not. I know there's other surgeons out there that do, and they specialize. These are very tricky areas. You have to be careful in terms of fat transfer to these areas, or if you're going to do like an implant or anything else. So I personally do not work on those areas. I like to stay kind of to like the lateral thigh and above. But there are other surgeons out there that you could look into that will do the calves and the ankles.
Can you combine a BBL with a lower bleph procedure?
So I usually would not recommend that. Okay, why is that? Because when you do a BBL, you can't be putting pressure in the buttock, and so you're typically lying face down, right? And because you're lying face down, you get a lot of swelling in the face and about the eyes. And so that's really going to cause a lot of strain and potentially a lot of issues or complications with your lower bleph. So it's not a good idea to combine those two surgeries. I would separate those out by at least 3 months.
How long is the rib remodeling surgery?
So how long does it take? It usually adds about 30 to 45 minutes to the procedure. A lot of times we're doing it as an add-on, so it adds about 30 to 45 minutes to that procedure. We're doing it on its own. It's probably about a 1 hour procedure.
Is it true that fat in the hips do not stay?
So I would say that is not true. I think the fat in the hips tends to stick. Now, having said that, not 100%, so you're not going to get 100% of the fat to stick, but you should be able to get anywhere between 60 to 70% of the fat in the hip to stick, which is typically enough to really, improve that hip dip area, kind of smooth the contours, give you more of that hourglass shape, make you feel like really, confident in that dress or those leggings. So definitely the best way to improve the hip dip area is with fat transfer.
How many massages a week do I need post-operation?
If we're talking about liposculpture or BBL, you're going to need a minimum of 20 massages after surgery to optimize your results, and that is the bare minimum. Sometimes you may need 25 or even 30.
For your patients, do you like if we give you wish pictures or collages?
Definitely. So I do enjoy, the vision boards or the wish pics or whatnot. Doesn't mean you're going to get it, right? But at least it gives me an idea of what you're thinking of, right? And from there, I can use that as a kind of stepping point to tell you whether, okay, yeah, maybe this one I think we can achieve, or no, this is completely unrealistic, and let me tell you why. And so that helps me kind of guide the conversation in order to then set realistic expectations for you.
Amazing. Does a faja kill fat cells?
No, but you have to have the right faja, right? So the faja needs to be tight in the waist, but obviously loose, and has to have that different material in the hips and the buttock area, so that it's not putting too much pressure in those areas. But yeah, we put all of our BBL patients in fajas.
Is 500 cc's per cheek enough for a BBL if you have shape already?
Yeah, sometimes it definitely can be, especially if you're looking for that skinny BBL, or sometimes we can call it the kind of enhanced natural types of look, or athletic Pilates type of looks. Definitely for those types of looks, 500 cc's per side would be able to achieve that, and it would be a very, very nice change. And it would also be something where people are, where you keep people guessing, right? Like, oh, I don't know, she looks fantastic, but what did she do? Did she have surgery? Did she just go to the gym and, hit the squats really hard? So if you want to have like that type of look, then typically 500 cc's would do okay.
Do you do rhinoplasties?
So I don't personally do the rhinoplasties here at Pure Plastic Surgery, but my partner, Dr. Vidal, does. So Dr. Vidal is our partner here at Pure Plastic Surgery that does like the facial surgeries. So if you're looking for anything kind of face related, whether it's the nose, the eyelids, the facelift, neck lift, or the ears, then yeah, definitely we have Dr. Vidal here who does a great job with these facial surgeries.
One of my friends got her breast augmentation. She got gummy bear implants. She was informed that she does not need to replace them at all. Is it true that you need to replace them every 10 years?
Right, so that was true, but it's actually, so your friend is correct. It's not true anymore. It's not true today in 2025. So a few years ago, that's what we recommended, but it's not the current recommendation. If you're getting the newer implants, which is what you should be getting, but if we are getting what we call either 5th generation or 6th generation cohesive implants, which is what people call the gummy bear implants. So with those 5th or 6th generation highly cohesive implants, if you're doing well, everything looks good, there's no problems, no symptoms, no issues, there's no need to exchange them.
How can I quickly increase my hemoglobin?
All right, so the most common reason for having a low hemo level is not having enough iron in your system. So you want to start eating foods that are higher in iron, such as red meat, but of course things like spinach as well. And you can also do iron supplementation. So there's two that we use here. One's called Floridix, one's called Hemoplex. You can do that as well. And then number 3, you want to take supplements that help you absorb the iron, and that's going to be folic acid and vitamin C. So if you do all those things, you should be able to increase your iron. That should help your hemo level. Now, again, this is for most people, not everyone. Some people have other issues going on and may have, the thalassemias or other blood issues that may not allow them to increase their hemo level. So, if you're really having trouble, then I would recommend you talk to your primary care doctor.
Can I get a BBL and a fat transfer to the breast in the same procedure?
Yeah, you can certainly do that. And if we have the fat, right? So we can put it anywhere you need. So Dr. Vidal today was talking about like places you might not think about getting fat that may help. So yeah, we can certainly put the fat in the buttock and hips. We can put it in the breast. We can put it in the labia, or we can put it in the face. So these are all potential options that can be done at the time of BBL.
There's different stages for fajas, right? Where would we get them?
Yeah, so there are different stages for fajas. The first faja that you're going to use after your BBL procedure is what we call a stage 1 faja. And the material there is more stretchy, okay? So it gives you some support, but it's definitely, it's not the one that's going to feel super constricted. And so that's your stage 1 faja. And why do you need a stage 1? Because at the beginning, you don't want to put too much pressure on the skin, because then you can cause problems like faja burns, right? And you don't want that, okay? So you're going to start with a stage 1. You're going to use that for about 5 to 7 days. Once the skin looks like it's kind of bounced back and it's looking better, then you can switch to what's called a stage 2 faja. The stage 2 is going to be a different material, and it's going to be smaller. It's going to constrict you more, okay? But in the first 6 weeks, even with that stage 2 faja, you still have to wear your foams and your boards underneath, which then brings me to the potential stage 3 faja. That's going to be at 6 weeks. So at 6 weeks, you're going to remove the foams, you're going to remove the boards, and so now you're going to need a tighter, more compressive faja, which is your final stage 3 faja.
Do you do the internal bra procedure?
Yes. Oh, well, I didn't mention it, but it's not really it's an add-on. You can add that on to some of these procedures here. So that is when you put an internal mesh or bra into the breast pocket or the breast itself to basically provide a little bit more strength, typically to the lower pole of the breast. And these are usually for people that have very thin skin that tends to stretch out a lot. And you need to add some of that support so that the implants don't fall or bottom out, or so that the breast itself doesn't fall or bottom out. And so you can add these internal bra or mesh at that time to help give you some lower pole support.
When can you go back to active work after getting a BBL, and what's the downtime look like?
Yeah, so if you are in you are in the type of job that's going to require heavy lifting or strenuous activity, like for us, like the most common ones that we get are police women and nurses, okay? But of course there's other jobs out there as well. Then you're gonna have to be off of work for 6 weeks, unless it's some sort of light duty option. But yeah, no heavy lifting, no strenuous activity for 6 weeks. Now, if you're more in a job like an office type setting, you can usually go back after about 10 days or so, 7 to 10 days.
Do you do in-office consultations?
Yes, so we certainly do. There's 3 types of consultations that we do here. There's the first type, kind of the quickest, most efficient type of consultation is a virtual consultation. So in order to do that, you go to our website, which I put up here, okay? You go to our website and you're going to see a button that says Start Your Journey or Virtual Consultation. And that's one where you put in your questionnaire, you fill out the questionnaire, put in your information, send us the photos. I take a look at everything, make my recommendations, and then you get a call from my coordinator. All right, that's number 1. Number 2 is we can do a video consultation. So we get a lot of patients from out of town, so they're not in Miami, they're in different states or different countries, but they still want to kind of talk to me kind of face to face. So that's going to be the second option. That's a video consultation. That does have a charge of $250, okay? The virtual consultation from the website is $0. The video consultation is $250. And then if you want to have an in-house or in-person consultation, we can certainly do that as well. So that's the third type of consultation that will have a charge of $500. However, all these charges, the $250 or the $500, they go towards the procedure when you book the procedure, right? So it's not additional monies. It basically goes towards that procedure, okay?
Can you add fat to the breast with the internal bra procedure?
Okay, so it's not, I wouldn't say it's a common combination, but you can do that, I guess. That will probably be, if you're not adding an implant, right, because you're adding fat, and you just want to, help support kind of the lower pole of the breast. It's a possibility, but honestly not a very common combination to do that.
If I had a breast reduction, how long do I have to wait to get a tummy tuck?
0. You should do it together. You already had the breast reduction? Oh, okay,
Yeah.
okay, I'm sorry. Well, typically, if you're thinking about a breast reduction and a tummy tuck, you should do it together, right? It should be like a mommy makeover, so you can combine your breast reduction and your tummy tuck and just get it all done at the same time. Now, if you separate it out, you already had your breast reduction, then I would wait 3 months and then you can do your tummy tuck. So you can just get fully healed from that breast reduction.
Is your clinic pay all in full, or do you have payment plan options?
Yeah, we have several financing options, multiple financing options. Okay, so yeah, you don't have to put everything up all at once. We have a lot of our financing partners. So we have Care Credit, we have Alpion, we have Cherry, we have Affirm. Basically, we look for the best one for you. So yeah, that's not going to be an issue. So you need financing, we can help you out.
Do you do a hernia repair with the tummy tuck if I had one?
Yeah, definitely. So that's one of the advantages of the tummy tuck, is that we can fix the hernias, and we can fix, mostly like any belly button hernia or a ventral hernia, meaning one that's kind of in the midline up here. We can fix those hernias with your tummy tuck.
Can you get a breast augmentation, tummy tuck, and BBL all in one?
So I do not recommend doing that, and I do not combine all of those procedures, okay? So breast aug, tummy tuck, for sure, that's your typical mommy makeover. And that I would recommend doing first, and then come back 3 months later and do your BBL. Why is that? There's multiple reasons, but one here in Florida is that if you're doing a tummy tuck and a breast aug, you can only remove 1,000 cc's of fat via liposuction, and that's typically not enough to give you the body contouring that you want, nor the transfer that you want. So you're gonna lose out on the BBL portion of it. And then the other one, it's about your safety, right? Here at Pure Plastic Surgery, your safety is our number one concern. Now, we don't want to do anything that's going to increase your risk. And when you combine a breast aug, tummy tuck, and BBL, that is certainly 100% increases your risk. You are a higher risk for infection, higher risk for what's called skin necrosis or skin dying, higher risk for wound breakdown, higher risk, importantly, for blood clots, which could be potentially deadly, higher risk for bleeding and needing blood transfusions. It's just not worth it. So you're gonna get less bang for your bucks and a higher risk. It's not worth it. It's best to separate those procedures.
Do you do scar revision for an arm lift procedure from a previous surgeon?
Sure, we can do that. No worries, we'll fix it.
How much fat is able to be removed for a BBL?
So the max amount that can be removed in Florida is 4,000 cc's or 4 liters. However, that's Florida, right? Every state is a little bit different. Every country might be a little bit different. But here in Florida, the max we can remove is 4,000 cc's.
I only have 10% body fat. Loose skin is my issue.
Okay.
Can you help with that?
Yeah, so if loose skin is the issue, then we have to remove the loose skin. So it depends on where exactly the loose skin is, but I'm going to assume probably the loose skin is in the tummy or abdominal area. So that's going to require a tummy tuck, right? But if the loose skin is in the breast area, maybe a breast lift or a breast lift with implant. Given the 10% body fat, you probably need some volume. If it's in the arms, you can do an arm lift, right? If it's in the face or the neck, you can do a face lift or neck lift. So it's not unusual to see this, especially nowadays, because it has to do a lot to do with weight loss. And nowadays, right, we have like the Ozempics and Mounjaros, we have the GLP-1s, which have allowed people to lose a lot of weight very, very quickly. And that's great because it's great for your health. But the downside to that is that it leaves a lot of loose skin, right? And unfortunately, you cannot work out loose skin. There's no amount of going to the gym or exercising is going to get rid of loose skin. And so then we have to deal with it by removing it, basically cutting it out with these procedures that we do.
Val said, thank you for being so informative and personable, Dr. Earl. We appreciate it.
Awesome. I hope you guys are learning a lot. And remember, I'm here every Wednesday on Hump Day, around 4:30 p.m. And I'm happy to answer all your questions.
One more question here. In case I want to do the BBL before a mommy makeover, is that a good choice?
Not my recommendation, right? My recommendation is to always do the mommy makeover part first, specifically the tummy part, the tummy tuck part of it first, okay? And then come back and do your BBL in the second stage 3 months later, or of course anytime after that. That is going to give you the absolute best result. Okay, because when we do the tummy tuck first, there's no scar tissue and other stuff underneath there from like prior lipo and things like that. And so we're really able to really stretch that skin down and get the most snatched look if you'd like, remove the most amount of excess skin, and also go ahead and repair those muscles so that you already start looking super, super great in the front with the breast and the tummy for that mommy makeover. And then we really kind of bring it all together with the BBL afterwards. And we can even do like high definition kind of liposculpture, and that's, later when we do the BBL, because now everything's nice and tight. You cannot do high definition liposculpture when things are all loose. Okay, so if you have the choice, I recommend do your mommy makeover first, come back at least 3 months later, 3 months or later for your liposculpture and BBL.
One last question, actually, because somebody said I skipped your question.
Oh boy, no skipping.
Do you do skinny BBLs?
Definitely, 100%. So actually, not only do I do skinny BBLs, but it's something that I really dedicated myself to. And I even have my own version of the skinny BBL, which is trademark. It's called the South Beach Butt Lift, because it's it's different, a little bit different from your typical BBL or Brazilian butt lift. So yeah, I have my own trademark skinny BBL. It's called the South Beach Butt Lift. And what makes it different? Yeah, we're doing it on smaller patients, lower BMIs. We're doing it with very smooth transitions, enhanced natural athletic or Pilates types of looks. And I'm doing it with minimal incisions in very hidden locations where you can't see any of the incisions that we put you through. So even if you wear this tiny bikini, tiny even thong bikini on South Beach, no one's gonna be able to tell that you had the South Beach butt lift, because they can't see your incisions, and you look completely natural, just a whole lot better. So yes, come here if you need a skinny BBL.
Amazing.
All right. Okay, everybody. Well, I hope that was super, super helpful. And like I said, we're here every Wednesday on Hump Day with Dr. Alex Earl. Bring your questions, and I'll be happy to answer that. All right? Take care, everyone. Ciao.